Hello, everybody. Good morning, good evening, good afternoon, depending on where you are in the world. Welcome to this latest IMCO Maternity Natural Health webinar. And we're going to be welcoming today the wonderful Lyndall Mollard. And I'm going to be introducing her shortly, which is wonderful. And I'm just letting some people just sign on, and I can see those numbers going up. And just a reminder to everybody that we'd love to know where you are in the world and what your role is. So that would just be fabulous if you put that into the chat room and say hello. The format today is going to be, after we've just finished this introduction, Lyndall is going to take over for about 30 to 35 minutes, including some PowerPoint. And I know she's got an amazing presentation that she's going to be talking to you about today. And during that time, don't hesitate to go into the Q&A section and jot down any questions that you want Lyndall to answer, and we'll make sure that they get answered before we close off today. So yes, welcome Lyndall. Say hello.
Hello. I was just going to say, I was actually just looking at the attendees' names, and there's a few very familiar names that I know that have either done the course, a variety of courses with me, or I've taught. So, and anyone else, hopefully you enjoy this next section. It's a bit of a taster of different things, but I hope you do enjoy it.
I'm so looking forward to this. You know, this is absolutely right up it's the whole fundamental thing that IMCO is all about. But for those of you that don't know Lyndall that well, she has a doctorate and is a Master of Midwifery, and certainly reflexology and acupuncture is what she'll be talking about, is certainly her skill set as well. And for the last sort of 35 years, her midwifery, you've been a midwife for 35 years, which is fantastic.
Probably maybe a bit more than that.
Maybe a bit more. Time goes by quickly, doesn't it? Yeah. And so she has been teaching maternity reflexology to midwives and to reflexologists since 2007 in Australia and New Zealand and Japan. And Lyndall's got a very strong interest in that whole complementary and alternative medicine, which is what she did her PhD on, with a random controlled trials on acupuncture, which I know that she'll talk about today. Yeah, and also in a very interesting national survey of Australian midwives. So look, welcome Lyndall, and take over.
Okay, so you can see the screen now. Can you see my PowerPoint?
Yes, I can see your PowerPoint.
Hopefully everyone else can.
Yeah, we've got a reaction there. Yes, all good.
Yeah. So, as Kathy said, I've had a strong history, and I at the end realised when I was doing the slides at 10 o'clock last night that it was actually more than 15 years if you look back to 1998. So it's actually more like 22 years. So, so let's start on the journey. So I'm currently lecturing. I've done that for the last 3 years, but prior to that, I was a clinical midwifery consultant for 15 years and a clinical midwife. Also, I'm the principal of my company, Soul to Soul Maternity Reflexology, and as Kathy said, I get the fortunate opportunity to usually teach around Australia, New Zealand, Japan, but that's sort of we've been a bit quiet in the last couple of months due to the COVID. So we're just looking at how to actually run some courses by webinar. But so what I'm going to do today is briefly just look at CAM in pregnancy and childbirth worldwide by women, refute the claims, and this is a big thing that I'm very passionate about, is that complementaries are dark arts or hocus pocus. So we're going to look at some of the evidence. Looking at reflexology and acupressure with a triad of mind, body and spirit. However, I'm going to focus on reflexology and I'll explain why later. And then hopefully have enough time at the end to look at my journey and the challenges and opportunities, introducing reflexology and aromatherapy in a hospital maternity setting and looking at what that required. Okay, so if you have a look at a definition of CAM, which is a group of diverse medical and healthcare systems, practices and products that are generally not considered part of conventional Western medicine. And I put the Western in there because it is part of a conventional care in other countries around the world. So if you want to look at three broad categories, there's natural products, which are herbs, vitamins, minerals, teas, and dietary supplements. Looking at mind-body medicine and manipulation, such as yoga, chiropractic, osteopath, meditation, massage therapy, acupuncture, relaxing techniques, tai chi, qigong, teaching touch such as Reiki, hypnotherapy, and movement therapies. And then you've got your body-based systems such as Vedic medicine, traditional Chinese medicine, which includes acupuncture and herbs, and lifestyle changes, homeopathy and naturopath. So why women specifically and pregnant women are choosing CAM is because the researchers found that women are choosing CAM as they perceive that they have more control, more choice and more autonomy in their own healthcare decision making. And it's really interesting that in 2014, the National Centre for Complementary Medicine changed its name and it's now called Complementary and Integrated Health. So to encourage CAM and practitioners and Western practitioners to work together. It's a bit hard to say CIH, so I'm going to continue using CAM, but look out as more research and more information is now using the other abbreviation. So a little bit of background. It's interesting that there's been a number of surveys or integrated reviews looking at studies asking women, especially pregnant women, around their CAM use. Not so much in the last probably 5 years, and unfortunately nothing from New Zealand at this stage. So if anyone wants to do a study of that's published of pregnant women's use of CAM, there's been one study by Harding and F.E.A.R, but they looked at midwives' use of CAM and asking women what CAM they used. But and each country varies. So in the UK varied from 26.7% up to 57%. And that was in 2014. In Australia, back in 2008, it was about 72%, up to about 60.7% in 2014. Italy was 68%, Germany about 50%, and Qatar varied from 30 to 67%, so quite a range there. There's been a number of studies just looked at herbs, which is a bit narrow, and on average around the world, it's around about 30 to 40%. But when I looked at the top 5 CAM used by pregnant women, for example, in Australian studies, it was vitamins and minerals, herbal remedies, massage, aromatherapy, and yoga. And that varied from about 2004, 2008, and then 2011. So when women were asked who actually, where do they get their information about CAM, midwives and GPs and obstetricians were a source, but also family and friends was a high use they nominated, and magazines So I just want to go into, I call it F.E.A.R, which is false evidence appearing real. Back in August 2018, there was a media release on CompChem in the press, the Australian press, specifically in South Australia. Professor McAllister McLean, who is a founding member of the Friends of Science in Medicine, and I think that's an oxymoron because he published quite strongly, both on radio and news, that chem was dark science, hocus pocus, nonsensical woo-woo, dangerous, unproven therapies with false claims, and there's no scientific evidence of its safety or efficacy. And as you can, for people who can see the slides, the title was called Mugwort for Mugs. He heavily criticised the use of moxibustion and acupressure during pregnancy. Let's take a step back, which a lot of people may not realise. Before this occurred, was my first paper published for my PhD reported on this national survey of midwives. And the study was surveying midwives on what they recommend or suggest women use when they actually are overdue or post dates. And midwives, I've produced the top 5, and the top 5 included acupuncture, acupressure, and 3 other remedies, complementary modalities. So that was in March of 2018. He then, with his colleagues, wrote a letter to the editor, and it was entitled Teaching Midwives to Poke Needles into Non-Existent Meridians. And they went on about acupuncture and the lack of evidence. And if you'd actually read the article, at no point in our paper did we actually talk about using acupuncture or teaching midwives or student midwives acupuncture. We were only reporting on a survey. So we were able to respond to his claims. And what we did say quite clearly is that part of health professionals, whether it's midwives or doctors, code of ethics and code of conduct, is that we are actually required to provide women with factual evidence about risks, benefits, and the research so that they can actually make an informed choice, which he seemed to think that was not appropriate. So what we did was I want to look at the evidence that surrounds, especially the top 5 that I was talking about in the research and in what pregnant women use, their complementary therapies. So the biggest area where there's systematic reviews is the Cochrane Library. And you can't actually have a review through the Cochrane Library if there's no randomised controlled trials. So just having a Cochrane review on acupressure or acupuncture or complementary therapies, that means there is some randomised controlled trials, which means there is some evidence. So I was able to find a number of Cochrane reviews, such as acupuncture or acupressure for induction of labour, looking at pain relief, looking at, and a lot of them are about pain relief in labour, massage, reflexology and other manual methods of pain relief. There's been a systematic review looking at the effects of massage on preterm babies. There's been a relaxation techniques for pain management. There's looking at nausea and vomiting in pregnancy, which shows that ginger is one of the best remedies. And also there's been in looking at aromatherapy in interpartum midwifery practice. However, I do acknowledge that the research in some complementary therapies is limited. but quite often that's due to funding, because it is very challenging, and I have had experience myself, attracting any funding to undertake chem in the maternity setting, quite often because you're not using any products, especially if you're using acupressure or reflexology. So it can be a challenge. If we had to use a drug from a pharmacy company, we probably actually do well. Although when we've looked at aromatherapy, we've been supported by some of the companies. So what I've briefly on the slides been able to show you, and for the people who are listening in, sorry, I'm actually not going to read all out the studies, but I've been able to find 22 randomised controlled trials, which are the golden standard by Western medicine, for the perinatal period. And so this perinatal period meaning pregnancy, birth, and the postnatal period. So looking across the whole continuum of care. And the 22 randomised controlled trials were able to show with varying effectiveness, but what they were able to clearly show was that there was no, at any point, any harm to mothers or babies as part of the studies. Okay, so when we have a look at 10 mugs for mugworts, this moxibustion, and unfortunately I don't have time to go through, that's another whole webinar on moxibustion, but that's the use of, as the picture shows there, of mugwort, or it's a specific candle, if you want to call it a candle, of herbs that are originally from China, and has been used for centuries on bladder 67, acupressure point, acupuncture point, to actually help with babies turning from a breech back to head down position. So there's been 10 randomized controlled trials that have all shown overall a majority that it does work. There's never been any adverse effects on mother or baby, and in fact has less side effects than having it manually baby moved by a doctor. And it's actually more cost effective because it reduces the need to have a cesarean section. So acupressure in the perinatal period, 30 randomized controlled trials. Most of these are around labour, around reducing the pain, reducing the length of labour, which is fantastic for women. There is an increasing number of studies now being done in the postnatal period, looking at recovery after a cesarean section, also in pregnancy, the nausea and vomiting. There has been a meta-analysis undertaken in 2016, which showed that there was a significant reduction in the length of labour and the need for cesarean section. And then when having a look at reflexology, there's a 29 randomised controlled trials, again, varying from pregnancy, labour and postnatal period. One of them was my randomised controlled trial, which, believe it or not, was back in 2003, and some of the colleagues that are participants of this webinar actually were assisted me as midwives in conducting that study. Because of the time limit, I'm not going to go into depth around acupressure, especially looking at the mind-body-spirit connection. For more information, Deborah Betts, who's a New Zealand neonatal nurse and an acupuncturist, who's taught acupressure in the perinatal period to midwives and to couples in New Zealand, but also taught midwives in Australia all around the world. It's highly recognised. You can visit her website. So for people who can't see the screen, it's Betts is B-E-T-T-S. And on her website's fantastic in that she provides a free 23-page handout booklet, specifically focusing on acupressure for pain relief, but also involving the partner so that they just don't sit there and twiddle their thumbs and play on their mobile phone. And she has short little videos that people can watch so they can make sure that the acupressure points that they're using are accurate. Also, there are a number of one-page handouts that you can download looking specifically at what acupressure points to be used for priming labour, and also if the woman needs a medical induction, what points you can use to start before you require a medical induction. Also, if you wanted to Google my name, you'll find a number of publications, but definitely the last three have been around my PhD, which is around, one was a randomised controlled trial using acupressure for first-time mums who were over their due date. That was a feasibility study to actually look to see if pregnant women would use acupressure points, specifically 2 points every 2 hours during the day, and another point morning and night, or for at least 5 to 7 days until they went into labour. And it was interesting that they actually were quite happy to do that because they felt, again, involved and in control. So what I'd like to focus this next section is on reflexology. And I would have to say that mind, body, spirit, and I actually put body, mind, spirit, but for me it's mind, body, spirit, I'm used to saying. That I've experienced and seen the amazing journey women have had receiving reflexology, specifically during pregnancy, and the effect that it has on the newborn itself. And because as you're using foot reflexology, you're actually going over the zone of technically where the baby is on the foot, and I'll show you some photos shortly. Also, as Kathy said, I've conducted maternity reflexology to reflexologists since about 2008 in Australia and New Zealand, and part of that course is that reflexologists assignments are that they do 4 case studies over about 5 sessions with women who are pregnant, and then they sit their assessments and their case studies and their journey during the course. And I'm amazed and humbled by the increasing stories about about women and reflexologists, that randomised controlled trials cannot and will never be able to showcase or capture, and that's the women's experiences and their voices about their enjoyment receiving reflexology, and they believe the difference, and it's far beyond what any placebo effect could have. So interesting in reflexology, everything that's on the being or the body is reflected on the feet, and that includes pregnancy. And so similar to as the uterus and the baby grows on the abdomen, and midwives we use like around the belly button, the navel area is around 24 to 28 weeks, and then right up underneath the rib cage there is around 36 weeks. It's the same reflected on the feet. And so as the baby grows, if you've got the 2 feet together, that's the left and the right side of the body. And because the baby's in the middle, it will actually start to appear on the inner aspect of the feet. So as you can see here, around 12 weeks, it's very small, and it will slowly grow up and grow up and up. And people go, oh, you've got to be kidding, you know, he's about 24 weeks, and then about 32 weeks. And being able to palpate or feel the baby on the feet varies depending on the way people carry the baby, but also too, if a woman's got a high arch or a flat foot, does seem to have an effect. Sometimes you can't see it, but you can actually feel it. and it's more on one side than the other. Unfortunately, photos are only 1D, it's not 3D, so it can be quite challenging sometimes to capture that on photos. And I know a lot of reflexologists and midwives, when they've tried to do it, say, but I can see it so clearly, but when I take a photo of it, it's a bit harder. So if I said, okay, can you see a pregnancy on this foot? Or a bulge here on one side more than the other, and that's usually where the baby's back is. Has nothing to do whether it's a boy or a girl, which is on the left or the right foot. And maybe you can see that there's a increased protrusion, bump there, yeah, compared to that one. It's not as so clear. Usually I have a lot more photos, but I thought I'd just focus on a couple. So this one is actually a small woman. She's only about 5 foot tall, whatever that is in centimetres, if that. And she was pregnant with twins at 32 weeks. You probably may be able to see it maybe a little bit easier on that slide, but what I'll do is I'll actually got one with marks. So that's sort of the top, and you can see sort of a crease down here. And I'm sorry for the people who can't see these. I'll have to work out some other way. Or you can have a go at see if you can see someone on pregnant feet. Here you can see this one quite clearly on this side. And then there's another one over here. Okay. So looking at reflexology, a lot of people say not to have it in the first 12 weeks because you can cause a miscarriage. Unfortunately, reflexologists are not God. They can't cause a miscarriage. It's usually nature, or there's a reason why there's a miscarriage. But it's excellent for, especially in the first 12 weeks when there's rapid hormonal changes, and morning sickness and a variety of other things, including women can get very tired in those first 12 weeks. So it's absolutely perfect for helping to maintain balance, and reflexologists are aware to work within their limits of their scope of practice, but also too that they actually don't work on that pelvic area or to stimulate it, but they can provide a lot of other reflexology techniques for hormonal balances. In the second trimester, reflexology comes into its own because it can provide both a physical, emotional, that mind-body-spirit connection during the pregnancy, and in turn, the new soul coming into the world. And as I said, by working on the feet, they're also working over the zone of where the baby is. Reflexologists also has an opportunity, quite often they've got a bit more time than midwives during the pregnancy to also just touch base with the women about their nutrition and their exercise and their movement. However, they only again work within the scope of practice. But part of that is around talking to women about being able to meditate and relax and being nurtured and cared for. And that's what I'd have to say when we did our randomised controlled trial, was that that's what women felt, that they felt having reflexology, it's more than a massage, that they felt cared for. I've put epigenetics in there. I haven't got time to talk about that at this stage in this presentation, but looking about the effect that women, what epigenetics has on the incoming baby, the soul, as well as physically. So it's more than just genetics, it's the environment that's around the baby. So if mums are relaxed and reduced anxiety, therefore reduced adrenaline, it does have an impact on baby's growth and other things. So reflexology in this period of time for relaxing and hormone balance, but also any imbalances, whether it's heartburn, backache, and a variety of things. But again, encouraging women to be active and looking after themselves with the support of their partner. Third trimester. So Women usually by this stage can be feeling really tired, stressed, with a variety of minor discomforts. However, for some women, they don't think they're minor, that they actually sometimes take over that pregnancy, especially insomnia, backache, sciatic pain, urinary frequency. Unfortunately, reflexology can't do much about that, but they can, and it doesn't get rid of any of the symptoms, but what it can is reduce the severity of it. And one of the things also is not just the physical part of having reflexology, it's actually that listening ear and women being reassured and using positive women-centered language. And some of the discomforts using lymphatic techniques to reduce swelling, endocrine balance, and lifestyle changes. In the immediate postnatal period, reflexology, women are experiencing a huge range of emotions, the agony and the ecstasy of birthing. They might be jubilant, they might be exhausted, they might be sore, they might be full of wonder or disbelief that they've now got this new person in their life, and there can be conflicting and confusing emotions and feelings. So, and then again, on top of that is the hormonal changes from pregnancy to postnatal period. So again, reflexology is an optimal time for the mother, taking time for herself, and that can be challenging. But we've given reflexology with the mothers holding their baby, except we're going to make sure that they're strapped in well in case the mothers fall asleep. We don't want to have the baby falling off the massage table or the reflexology chair. But also it's a time to debrief, because sometimes they may not get that opportunity in busy postnatal wards. So quite often, this is a time where if the reflexologist's been on the journey with the woman, it's time for them to tell them their birthing story. And again, reflexology is fantastic for either general well-being or in specific things of whether they've had a really traumatic long labour or a really short overwhelming labour or a caesarean section. So there's a variety of different relaxing techniques for hormonal recovery, for stress and anxiety, especially if there are any concerns, if they're first-time mum. And that ability to connect that mind, body, spirit, the head and the heart. And of course, then there's baby reflexology. And I find that this is amazing in that you're holding the soul, as in the two souls, S-O-U-L and S-O-L-E, in our hands. And I've got a couple of pictures here, and unfortunately for the people who can't see it, one of them is artwork of an incoming soul. Part of the course for maternity reflexology for reflexologists is they have to do an artistic, if they want, on the incoming soul. And so one of the pictures on my slide is of one of the very artistic reflexologists. Another one's a photo of one of our reflexologists in Western Australia, and she had been providing reflexology care through the pregnancy of her granddaughter, her daughter, and then actually then provided reflexology to her grandson. And she's just doing a calming hold on his lovely little feet, and she provided the photo for me. And she said it was amazing. As soon as she put her hands on his feet, he just calmed completely down and relaxed, and was very, very happy. So whether that's memory from receiving reflexology in utero, or whether it's the calming hold of grandmother, it still works. This slide is just a variety of 5 main simple little techniques that you can do for baby reflexology. So looking, as I said, that solar plexus hold showed in the previous picture over the, we call it the reflexology solar plexus. However, for acupressure or acupuncture, it's in kidney 1. Looking at the ball of the feet, which is the chest area for colds and flus, including the toes, doing the little, this piggy went to market, this little piggy stayed at home, this little piggy had roast beef, and this little piggy had none, and this little piggy went wee, 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 all the way home. And that is stimulating the toes for any congestion in the sinuses. The other one is walking along or sweeping along the colon on both feet, going up and across and down to help with any constipation. Or you could do round and round the garden like a teddy bear. Again, that's doing that. And so it's interesting when Susan Enza taught me that, and she said those nursery rhymes, I wondered whether it was actually reflexology that we didn't know that we're actually giving. So, how we go for time? Actually, I'm nearly on time. So a quick thing about my journey. It's actually more than 15 years that we said I thought it was going to be. It's actually a little longer than that. But, and as I said, a few people who are also present were with me on this journey. So in 1998, Susan Enza, the mother of maternity reflexology, which is what I call her, originally came out from the UK and taught a large number of midwives and reflexologists. And we did a specific midwifery reflexology certificate course. And then some of us were very lucky in that in 2000, we then did an advanced certificate in maternity reflexology with her. And I then went on and got an official diploma in reflexology in 2012 with Melbourne in the Australian School of Reflexology and Relaxation. Over a period of time, I've actually been interested in other complementary therapies and undertaken a variety of courses in Swedish massage, Chinese massage, hand reflexology, Chinese reflexology, aromatherapy, bowen therapy, acupressure, acupuncture for midwives, medical intuitive, and Reiki. I think that's it, as well as reflex. Yeah. So then, back in 2008, I started teaching reflexology and acupressure to, as I said, Kathy said, around Australia and New Zealand. Part of that journey was we then had the challenge of introducing it into the hospitals, and that required major work for a couple of years. So in one respect, it was good. We had a pharmacist staff member who actually had been trained in TCM, and Bernadette Laser, who's, I believe, online, who's a midwife and aromatherapist at the time. We did literature review, we rang around to other hospitals, we developed a policy. We were lucky, we had by that stage about 66 midwives trained by Susan Enza. We developed a aromatherapy policy and education package so that midwives could use aromatherapy in birthing suite, and we actually provided the oils. We also undertook a randomised controlled trial for pregnant women with ankle and leg edema, and that's been published. And we also did a quality improvement project for staff stress and burnout, which was published in Reflexology World in 2006, which showed that it reduced tension, anxiety, and the midwives absolutely loved it. So I've run out of time.
Oh, thank you so much. It's just been so fascinating listening to all these just updates on what these studies have been. Yep. And the amount of prominence of them all is so reassuring. Hey, everybody, we'll be winding up soon. So if you have any particular questions for Lyndall, please do type them into the Q&A now. And thank you for putting your details, those that have, into the chat area. It's so great to see people from all over the planet connecting with us. So that's so fabulous. Lyndall, is there anything that you'll want to kind of feel that you haven't touched on yet that we should fit in?
One final thing was that since I've been working at Newcastle University, we look like we're going to have next year an evidence-based complementary and integrated health course for midwives and nursing. It's a course as part of a master's program, or people can do it just as an, we're going to look at see if we're people that can do it as an individual basis. And it's online, and it'll be 12 weeks looking at the evidence for a variety, including some of the information that I've already provided. So I'm really keen because, again, it's quite challenging to even introduce it in universities, even though you've got all the evidence, because you still have people who are think that there's no evidence to support.
Yes, even though there's actually overwhelming evidence.
Yeah,
That is so exciting that you're going to have that course rolling out. And I guess that will be available internationally on being online?
Depends. It'll actually have to, it's only, it will be for nurses and midwives. So at this stage, mainly Australian, but yeah, we hopefully will be able to increase it and have it available as a standalone unit, which will be great.
Yeah, that's very needed. It's pretty fantastic. I've got a couple of questions myself. The wonderful little diagram that you had in the PowerPoint on the baby's feet and those 5 little areas that you can use reflexology on. Is it possible for our viewers to get a copy of that easily?
Well, it's interesting. I got that years ago when I was back in 2008, and when I went back to find it to acknowledge and include the website, I cannot find it now on the website. So I have to acknowledge that I don't know who owned it originally.
Okay, maybe we can borrow it as a screenshot.
Yeah.
Because I thought that was a really great little diagram. I also, can I just comment that wonderful, wouldn't it just be wonderful for it to be like part of postnatal routine care, that every woman after she gives birth has a moment with a reflexologist? And that whole sort of it's like you need to debrief your mind, but you need to debrief your body as well. When do you think would be, if there was an optimum time after birth for a reflexologist to touch base with that woman, when do you think it would be?
Depends which type of birth that they've experienced. I've given reflexology like within 4 to 6 hours after a birth. I've also given reflexology 12 hours after after a very complicated labour and a cesarean section where the woman's feet and legs were so swollen to give her relief. And luckily for me, I'd been seeing her through the pregnancy as well. So we had a rapport and we were able to have a discussion about her experience, which also then helps with any blockage and able to release the fluid, because I call it the issues in the tissues. So,
Yeah. But I guess if you are in that situation where you're caring for a woman antenatally and she's open to the idea of sort of booking in a reflexologist after her birth, but of course at that point we don't know what her birth is going to be. So would there be like a sort of standard guideline that you could say, like it might be, look, somewhere in the first 72 hours is really ideal, or what do you think?
yeah, again, it depends on where in the world she's also birthing, because in Australia, if it's a reflexologist and they haven't had approval from the organisation and they're a private practitioner and they're charging the woman, they may not be able to come in and actually provide reflexology in a hospital setting. So they may have to wait till after she's gone home. Whereas a lot of reflexologists, what I suggest that they do is they actually give a package deal where, like a coffee card, they 10 coffees and you get a free one at the end, is that, they can have a number of pregnancy visits and then the complementary one at the end, which could be the one when they're still in hospital. So the the reflexologist isn't paid to come in.
Right.
They're doing a complementary one, so they're actually coming in as a friend giving reflexology rather than a health professional. So,
I love that idea.
yeah,
It's sad that we have to resort to that, but yeah,
yeah,
that's
yeah.
a good way. Another question is, with those various studies that you were looking at, where it was asking the prevalence of CAM use in the antenatal period, or if we
Yeah.
just take it right across the whole perinatal period. I know different studies vary and different countries vary, but if you were to make an educated guess, which yours is an educated guess, more educated than the rest of us on this, but with an educated guess on what you think the prevalence would be if it was able to be looked at a global level, what do you think?
Aha. So, if you have a look at the true definition then of complementary therapies, including products, which includes vitamins and teas, the incidence would be 100%. Because,
Right.
because if you include yoga, if you include women who drink peppermint or chamomile tea, if you include women who take vitamins, then technically it's 100% of people around the world.
Right.
And that's the challenge when hospitals
Fascinating.
are trying to really regulate the use of complementary therapies, and that they want the women to go and be reviewed by doctors to make sure that they're safe in pregnancy. One, the big concern is how the hell would doctors know what
Oh,
they're pregnant?
absolutely. What was this, how many years did they spend studying medical herbalism to make an opinion on medical herbalism or whatever modality that person is using? Yeah, that's
And the second thing is how ridiculous to actually go have a woman go to a doctor for him to prescribe peppermint tea or yoga or calming birth, calm birth or hypnobirth. It's absolutely ridiculous. So
yeah,
I
yeah.
think a lot of hospitals put that in, but to actually be able to do it. And I had a colleague who would say, "Of course, Lyndall, you're being silly. It's not peppermint tea isn't a complementary therapy." And I went, "Well, technically, by the definition that you've actually got in that document, it is, and
Yeah,
yoga is." Yeah.
yeah.
So I think
So
they don't know
fascinating.
what they don't know, which is a pity.
Yes, absolutely. Oh, look, that has just been so great. Has anybody else got any? Oh, yeah, we have got a question in here. So we've got a question from Nikki in Brisbane. She trained in the UK and held an aromatherapy certificate, which she used to teach classes for aromatherapy in labour. And when she moved to Brisbane, there was no such classes even existed. So, Lyndall, can you share your policy and education package information?
Um, I probably could. I'll have to check with Bernadette, who I believe is online as well here, because she actually developed it. And what we did was we only looked at 8 essential oils, and big one for a number of reasons. One was based on the research that was done by Burns and Blaney in the UK. Two, that we couldn't afford to use rose and jasmine because it was too expensive, so we used eucalyptus and peppermint and a variety of other things. Our hospital would only let us use 1 essential oil at a time. So, and because it was in birth suite, the 8 oils that we chose focused on that area, and we had to make sure that they were 100% pure, and that they. So part of the education package was included like 1-page sheets on how many drops of oil to use for what condition or symptom. So I'm happy. I'll check with Bernadette if because
Okay, that's great. Well, if everybody that's registered for this webinar will receive an email tomorrow, so we might be able to put any information like that in there. And yeah, that would just be wonderful. If I wait to hear. I always think it's very amusing how women when they're pregnant, myself included at the time, can feel like we need to be almost a little secretive, a little underground on what we're doing for our own health, because we know that probably our obstetric doctor is going to roll their eyes. Yeah, and it's like we need this supervision, because we could be doing something dangerous to ourselves and our baby. Yet as soon as that baby is born, nobody is breathing down mothers' necks going, well, you shouldn't be using that massage on your baby. It's like we don't know enough about ourselves when we're pregnant, but we know everything we need to know as soon as that baby's born. And the irony in that is kind of frustrating.
Yeah, and I'd have to say, definitely, if you look at women-centred care, part of that is providing women with information and evidence so that she can make an informed choice. But when there's been a study done by Denzel around Australia's universities, very few universities actually include information about CAM to doctors and nurses and midwives in their undergraduate program. So how they can even provide women, and that's why I'm really strongly believe in and part of that, my PhD, was that it needs to be included into, and it is in medicine, definitely increasing, but with, it's one of the only things that, if you look at, if it's 60% of women who are actually using complementary therapies, it's the only thing where we actually don't have that incorporated into our undergraduate programs.
I completely agree. I mean, it was quite a while ago that I did my training, but I recall, because I was very pro naturopathy mindset at that stage already, and I do recall it was sort of like in the third year we had a naturopath come along and do like a guest tutorial, and you're thinking, really, we've done all those years and that was all we got. So yeah, hopefully it is going to be changing. Now we've got Bernadette has sent a message through saying that she's happy to share the policy, so that's great.
Yep.
So after we finish with the webinar, Lyndall and I will connect, and we'll make sure that information comes out to you. And also the references, we've got another quick query in there from Anita. So are you, Anita, I guess you're talking about the references that were on the PowerPoint? Is that what you're meaning? You're wondering how you can access them? Just let her answer that.
The list of studies, say for example, for reflexology, that slide, I've actually got on my website.
Yes, she's particularly interested in the references relating to acupressure.
Acupressure? Okay.
What we might do again is just try and put some direction in the emails that you'll all get that will cover off some of that, so to tell you where you can source some of that information.
Yeah, because it's changing all the time, because I actually review journal articles prior to publication, so from around the world, especially on reflexology and acupressure for labour and birth, and so yeah, it's always growing, the number. So even last night we were able to add a couple more randomised controlled trials into there. So yeah, we can work on that.
Fantastic. Okay. All right. Well, look, we're a little over time, so we'll wind it up. But gosh, thank you so much, Lyndall. I know it's an early start where you are, and we all appreciate it. And it's neat to see people from so many destinations. And so thank you everybody for tuning in, and we look forward to seeing you at a next webinar. And we will be posting all of these webinars eventually onto the our YouTube channel that we're putting together at the moment, and also our website, so sort of watch this space on that one. So thank you very much, everybody. Thank you, Lyndall.
Great.
Okay.
Thank you. Thank you.
Bye, everybody.